treatment. So now if I talk about bleeding or hemorrhage, guys, usually, so in relation to surgery, this bleeding or hemorrhage can be of three types. This question has been repeated twice or thrice almost in the last few years. Okay? So it is important. Hemorrhage related to surgery can be of three types. First, if the hemorrhage occurs if the hemorrhage occurs during surgery, it is called as primary hemorrhage. If the hemorrhage occurs during surgery, it is called as if the hemorrhage occurs within 4 to 24 hours of surgery, it is called as if the hemorrhage occurs within 4 to 24 hours of surgery, it is called as and if the hemorrhage occurs 5 to 7 days after surgery, it is called as so within during surgery it is within 24 hours of surgery it is reactionary, and after 5 days of surgery it is no issues with this. So there are three types of hemorrhage: during surgery, primary hemorrhage; within 24 hours of surgery, reactionary hemorrhage; and after 5 days of surgery, secondary hemorrhage. No issues with this. Now, what is the most common cause of primary hemorrhage usually? Most common cause of primary hemorrhage, it can be anything. Maybe there was a bleeder during the surgery. Any vessel was injured during surgery. Okay? Most common cause of reactionary hemorrhage, if they ask you, it is slippage or ligature. The most common cause of reactionary hemorrhage is so maybe a knot was tied, but that was an insecure knot, like a granny's knot, and therefore it slipped off, and therefore the patient now presents to you with huge amount of bleeding within 24 hours of surgery. That is a classical case of reactionary hemorrhage. The most common cause of reactionary hemorrhage is slippage or ligature. Apart from this, there can also be other causes like a dislodgement of a clot or maybe increase in the blood pressure due to reflex vasospasm. So all of these others can be there, but the most common cause still remains slippage or ligature. If they ask you what is the most common cause of secondary hemorrhage, then your answer would be most common cause of secondary hemorrhage is so infection will present late in the course. That is, after 5 days of surgery, the patient will come to you with minimal bleeding. Reactionary, there would be huge amount of bleeding, but in secondary, there would be minimal bleeding. No issues with this, anybody? Cause samajh gaya? Now, if I talk about treatment, if it is usually during surgery, that means a primary hemorrhage. Here you just need to clamp and repair the bleeder. Here you need just to clamp and repair the bleeder. If it is reactionary hemorrhage, here the treatment would be re-exploration and religation. So that means the patient should be again taken to the OT. The site should be re-explored and the bleeding vessel should be re-ligated. So what is the treatment for reactionary hemorrhage? Re-exploration and re-ligation. Whereas for secondary hemorrhage, it is easy. It would be orally IV. So the patient needs to be admitted and then the patient should be started on IV antibiotics. The patient should be started on intravenous antibiotics. Broad spectrum like third generation cephalosporins can be given. Now in our case, patient underwent hernioplasty. Post-op period was uneventful. On post-op day 7, that means how many days after surgery? 5 days after surgery. Complaints of minimal bleeding from the site. So which type of hemorrhage it is? It is a secondary hemorrhage. And what is the treatment for secondary hemorrhage, anybody? Admit the patient and start IV antibiotics. No issues with this. Moving further. Then if I talk about blood donation, important है. Now, blood donation में, usually I hope all of you are quite aware that 1 unit of blood contains how much ml of blood? So in India it contains 350 ml of blood. 1 unit of blood contains, in US it is 450, but in India it is 350 ml of blood. And this 350 ml of blood, when it is taken from the donor, it is collected in a pre-sterile plastic bag. It is collected in a pre-sterile plastic bag. And this pre-sterile plastic bag, it is usually covered with anticoagulants. This pre-sterile plastic bag contains anticoagulants. So this anticoagulants which are present in the pre-sterile plastic bag, they are for the reason to keep the blood coagulation free, okay, to keep the blood clot free. Okay. So what are the anticoagulants used? This is important. Anticoagulants commonly used in this pre-sterile bag are CPD, that is citrate, phosphate, dextrose. What is CPD? Citrate, phosphate, dextrose. And second is CPD-A, that is citrate, phosphate, dextrose, acetate. A goes for acetate. So how does they differ? They differ on their half-life. Half-life of CPD is 21 days. Half-life of CPD is? Half-life of CPD is? Whereas half-life of CPD-A is 28 to 35 days. Maximum it is. So half-life of CPD-A is? Half-life of CPD-A is? No issues with this. So which two anticoagulants are used? First is CPD with a half-life of, and second is CPD-A with a half-life of 35 days. No issues with this. Now, for withdrawing the blood, the size of the needle which is used, it is how many gauge needle? 16 gauge needle. Which gauge needle is used? Which gauge needle is used? Which gauge needle is used for blood withdrawing? 16 gauge needle. No issues with this, anybody? Now, if they ask you about the BT set, so the blood transfusion set which is used, it contains a filter, right? So the size of the filter is how many microns? Very good. The size of the filter is 40 micron. The size of the filter is 40 micron. Size of the BT set filter is 40 micron. All of these are one-liners. Okay? Straight away. Temperature of storage of blood is, range would be 2 to 6 degrees Celsius. Range would be 2 to 6 degrees Celsius. On an average, it is 4 degrees Celsius. On an average, it is 4 degrees Celsius. So blood storage temperature would be, 4 degrees Celsius plus minus 2. No issues with this. ये important है, ये आ भी चुका है एक बार. ठीक है? Shelf life of RBC. So now if they normally ask you, the shelf life of RBC, normally it is 120 days. Normally it is 120 days. If they ask you the shelf life of RBC in stored blood, it is 50 to 60 days. In stored blood, it is 52. In transfused blood, it is 52. In transfused blood, it is 52. Whereas in stored blood, it is 24 to 72 hours. In stored blood, it is 24 to. So normal shelf life of RBCs कितनी होती है? 120 days. In transfused blood, the shelf life of RBC is, transfused blood में shelf life of RBC is, stored blood shelf life of RBC is, stored blood shelf life of RBC is 24 to 72 hours. ठीक है? Most common complication associated with blood donation is, so the most common complication associated with blood transfusion is, very good, it is the simple pyrexial reactions or simple febrile reactions, that is fever. So what is the most common complication of blood transfusion? Most common complication of blood transfusion is, fever, that is simple pyrexial or simple febrile reactions. No issues with this. Here you will only give paracetamol vagara to the patient. First of all, stop the BT and then give any other drugs to the patient. Okay? Next, if I talk about ABO incompatibility, that means if the patient was B positive and he is given an A positive blood, right? This is what is called as a mismatched blood transfusion or ABO incompatibility. So ABO incompatibility is also called as mismatched blood transfusion, right? No issues with this. So now, what is the most common cause of ABO incompatibility or mismatched blood transfusion? Shabash, it is clerical error. So most common cause of ABO incompatibility is, clerical error, means the error either by the one who is working in a blood bank or maybe by you. Okay? So error by the doctor or the healthcare staff, that is what is called as a clerical error. Okay? The most common cause of ABO incompatibility is, most common cause of mismatched BT is clerical error. Okay? What is the most common symptom? Most common symptom would be, very good, it is thrombophlebitis. And thrombophlebitis is described as pain and redness along the vein. Pain and redness along the vein. Okay? No issues with this. याद रखना. तो most common symptom, if they ask you, what is the most common symptom of AVO incompatibility? Pain and redness along the vein. What is the most common symptom of AVO incompatibility? Pain and redness along the vein. That is usually due to thrombophlebitis. Okay, no issues with this. But if they ask you what is the most common sign, then your answer would be oliguria. Patient तो नहीं बता पाएगा कि oliguria है या नहीं. So most common sign would be, most common symptom would be, most common sign would be oliguria is urine output less than 400 ml per day. Oliguria is urine output less than 400 ml per day. And what is anuria? Shabash, less than 100 ml per day. Okay, so most common sign of mismatched BT is oliguria. Okay, if a patient has mismatched blood transfusion now, what should be done? The first thing to be done is stop the blood transfusion. Second, we can give two drugs. First is for preventing allergies, we can give injection AVL. You can give injection AVL to the patient. And second, we can give steroid, that is injection hydrocortisone. The other drug which is given is injection hydrocortisone. Okay? No issues with this. And then whatever is the symptomatic management should be done. Okay? And AVO incompatibility agar hai, so as I told you, first thing to be done is stop the BT. Now they are asking you clinical questions. So as a clinical case aa sakta hai, when the patient is having AVO incompatibility, right, they will ask you what is the next step. So the next step would be stop the blood transfusion. If you have already stopped the blood transfusion, then the next step would be send the blood bag and the tubing back to the blood bank for regrouping and cross matching. For regrouping and cross matching. ठीक है? तो वापस चेक करेंगे कि correct blood आया था या नहीं आया था. No issues with this. And the third step is definitely giving injections to the patient. No issues with this, anybody? Very good. Moving further, now talking about the surgical positions that we have. ठीक है? सब है, बहुत सारे important बता दूंगा. Just a minute. These are the different positions used for surgeries, guys. The most common position used for surgery is supine. Most common position used for surgery is when the patient lies facing upwards. That is what is a supine position. It is used for all your abdominal surgeries, breast surgeries. Okay? This is your supine position. Next, in the picture B that you can see, the leg end of the table is elevated. The leg end of the table is elevated. And this is called as which position? Very good. This is called as the Trendelenburg position. This is called as the Trendelenburg position. And Trendelenburg position is used for anybody. Trendelenburg position is used for laparoscopic cholecystectomy. Okay, Trendelenburg position can be used for laparoscopic cholecystectomy. Mainly it is not used for that. Mainly it is used for your perineal surgery. Trendelenburg position is used for perineal surgery. Okay, no issues with this. Next one, at least position याद रखो, surgeries को ये पूछेगा नहीं, position image देके पूछ सकते हैं, ठीक है? So here you can see first one, the leg end of the table is elevated. That is called as which position? Trendelenburg position. If the head end of the bed or the table is elevated, it is called as. If the head end is elevated, it is called as. If the head end is elevated, it is called as reverse Trendelenburg position. It is called as reverse Trendelenburg position. This is used for laparoscopic cholecystectomy or breast conservative surgeries. This is used for laparoscopic cholecystectomy or breast conservative surgeries. No issues with this reverse Trendelenburg position. The next one here you can see the patient is having their legs on the stirrups. This is called as which position? Important. This is called as the lithotomy position. This is called as the lithotomy position. And lithotomy position is used for delivery. That is, it is used for obstetric or gynecological procedure. It is used for obstetric or gynecological procedures. It can also be used for urological procedures or perineal procedures. No issues with this. So which is this position when the legs are on the stirrups? Lithotomy position. Which is this position? Lithotomy position. And lithotomy position, it is usually used for which kind of surgeries? Obs-gynae surgeries, perineal surgeries and urological surgeries. No issues with this. Next, here you can see these both of them are lateral positions. These are lateral positions. And lateral positions are used for kidney surgeries. Lateral positions are used for kidney surgeries like pyelolithotomy or nephrolithotomy surgeries. No issues with this. Next here, this is also a lateral position. This one is a prone position. This one is a prone position. This one is a prone position when the face is when the patient is facing downwards towards the floor. And it is used for which surgery? Very good. It is used for spinal surgery. It is used for spinal surgery. Important. Okay, no issues with this. So mainly it is used for spinal surgery. And the last one, this one is a very good. It is a sitting position known as Fowler's position. Sitting position known as Fowler's position. And this sitting or Fowler's position is used for neurosurgery. That is your cranial surgery. Okay, sitting or Fowler's position is used for neurosurgery. Okay, so here you will get a bloodless dissection, bloodless feed you will get because the blood will go downward. Okay, no issues with this. So sitting position is called as which position? Sitting position is called as which position? It is used for which surgery? It is used for which surgery? Then facing downwards is called as which position? Prone position is used for which surgery? Prone position is used for which surgery? Then lateral position is used for which surgery? Kidney surgery. Lithotomy procedure or lithotomy position. Obs-gynae procedures or perineal procedures or urological procedures. So when legs are on the stirrup, it is known as which position? When legs are on the stirrup, it is known as which position? Then if the head end is elevated, it is called as? If head end is elevated, it is called as? If foot end is elevated, it is called as? If foot end is elevated, it is called as? And the most common position used for surgery is? Most common position used for surgery is? Now, nowadays for usually hemorrhoidal surgeries or for any perineal surgeries, pile surgeries, we can use either the reverse Trendelenburg, but it is not used. It is mostly the lithotomy position which is used. ठीक है? Reverse Trendelenburg कुछ लोग करते हैं अगर anterior कुछ करना. But anal fissures हो, all of these other surgeries, we generally previously used to use a position like this. Very good. कुछ और मत सोच लेना. This is which position? Jackknife position. Which position? Jackknife position. And this jackknife position is important from forensic also because this jackknife position was previously used for hemorrhoids and piles. Okay, but nowadays it is avoided because it is associated with important side effect, and that is it causes positional asphyxia. Jackknife position causes positional asphyxia because the abdominal contents will press the diaphragm and will cause respiratory distress in the patient. So ये image आ चुकी है. This position causes what? So this position causes positional asphyxia in the patient. ठीक है? Next, if I talk about this one, which is this position, important from ENT also. This is known as the Rose position. So it is a supine position, but here beneath the shoulder blade, there would be placement of a towel. Why? Because we need a neck extension. So 30-degree head end elevation and a neck extension is required in this surgery. Okay? So this is which position? So towel beneath shoulder blades is known as which position? And Rose position is used for which surgeries? Anybody? Thyroid and tonsillar surgeries. Rose position is used for? An important side effect क्या हो सकता है रोज पोजीशन में? ग्रिसेल सिंड्रोम. क्या हो सकता है? फ्रैक्चर होगा, डिसलोकेशन होगा. So it is a dislocation of C1 over C2. Dislocation of C1 over. That means atlas over axis. And this is called as which syndrome? Anybody? Grisel syndrome. This is called as which syndrome? So Grisel syndrome is a side effect of which position? Rose position is used for which surgery? Thyroid and tonsillar surgery. Grisel syndrome is dislocation of C1 over C2. That is atlantoaxial dislocation of subluxation. Okay, no issues with this. Important है ये भी Grisel syndrome आ चुका है exam. Then if I talk about this one now, ये सबसे important है anesthesia भी और surgery से भी. ठीक है? So talking about the cannulas now, IV lines bolo, cannulas bolo, you can call it gel growth, all of that. Okay? So here, I hope all of you are quite aware, the bore or the diameter of the needle is called as gauge. Bore or diameter of the needle is called as gauge. So widest bore would be widest bore would be, widest bore would be, narrowest gauge would be, narrowest gauge would be, narrowest gauge would be, narrowest gauge would be. No issues with this. Now याद कैसे रखना है, जल्दी से कर लेते हैं. Just a minute. So narrow, ठीक है. So you need to remember this image. It is easy, ठीक है. Starting from the earth's crust, that is lava. Lava is orange in color. Lava is orange in color. So the first cannula, 14 gauges, 14 gauges. Then soil or crust is green color. Soil or crust is, soil or crust is. Therefore 16 gauges, 16 gauges, 16 gauges. Next grass is green in color. Therefore 18 gauges, 18 gauges. Next flower is pink in color. So 20 gauges, 20 gauges. Then sky is blue in color. So 22 gauges, 22 gauges. Sun is yellow in color. So 24 gauges, 24 gauges. And last, याद रख लेना, stratosphere और ozone is violet in color. Ozone is, होता नहीं है, मैं बता रहा हूँ. Ozone is violet in color. Okay. So widest bore is which cannula? Widest bore is which cannula? Widest bore is which cannula? Which color? Narrowest gauge is which cannula? Narrowest gauge is which cannula? Which color? So now please let me know in neonates which cannula would be used. Neonates we will use the, neonates we use the, neonates we use the, children we use the, children we use the yellow or blue. Children we use the, so normal routine practice में yellow cannula children में जाता, blue cannula मतलब emergency में सब patients में जाता, ठीक है. So but अगर theoretically बात करें, so in usually in children we can use two cannulas, either yellow or, so yellow cannula is used in, blue cannula is used in. Adults we use the pink cannula. Adults we use the, so in adults we can also use the blue or we can also use the pink cannula. Now there was a question. A patient comes to you after a road traffic accident and the patient is in hypovolemic shock. The best cannula to be inserted is, so here we need maximum fluid resuscitation. Therefore we need to insert a widest gauge cannula, and the widest bore cannula is orange. Widest bore cannula is orange. That is how many gauge? 14 gauge. No issues with this. If orange is not available, then gray cannula. How many gauge? 16 gauge. And minimum in cases of RTA, which cannula should be inserted? Green. Minimum which gauge cannula should be inserted in RTA? Minimum which gauge cannula should be inserted in RTA? Minimum which gauge cannula should be inserted in RTA? सब green बोलो. Gauge बोलो. 18 gauge. Minimum how many gauge? Minimum how many gauge? So minimum 18 gauge. 2 IV lines are inserted in a patient of road traffic accident or any patient who is in hypovolemic shock. So minimum which gauge? Recommended which gauge? तो जल्दी से मैं पहले गेज बोलूंगा, कलर बोलोगे तुम, नेक्स्ट टाइम उल्टा करेंगे, ठीक है. जल्दी. 14 गेज, 18 गेज, 20 गेज, 16 गेज, 24 गेज, 22 गेज, 26 गेज, 18 गेज. शाबाश. Now green color, gray color, gray color, orange color, orange color, yellow color, yellow color, blue color, blue color, violet color, violet, pink, pink, green. For blood transfusion, which cannula is recommended? One more question, recall. For blood transfusion, we will recommend green cannula. For blood transfusion, we will recommend. For massive blood transfusion, we will recommend gray or green cannula. Or minimum which gauge cannula should be used for blood transfusion? Minimum pink cannula. Minimum recommended green or green. Recommended green or green. ग्रे और ऑरेंज तो दिखते भी नहीं हो तुम्हें प्रैक्टिस में, ठीक है. एक्चुअली नहीं होते हॉस्पिटल्स में. सो इट इज यूजुअली फ्रॉम द ग्रीन ऑनवर्ड्स, ठीक है. सो याद रखना. नो इश्यूज विद दिस एनीबॉडी? आई होप सो. Then what is this? A cannula was inserted and now the patient has pain and redness at the site. So this is superficial thrombophlebitis. This is superficial thrombophlebitis. Thrombophlebitis means what? Inflammation of the vein. Inflammation of the vein is called as thrombophlebitis. Phleb means vein. Yaad rakhna. So most common complication of cannula insertion is and what should be treatment? Change the cannula. Another side. ठीक है उधर ही मत ठोकना वापस. Patient जो गाली देगा ना. Next, now talking about some instruments, surgical instruments. So the first one, important है बस नाम याद रख लो. They will not ask you the function. एक दो को छोड़ के, ठीक है. At least remember the names. First one is the jaw thyroid retractor. First one is the jaw thyroid retractor. So first one is the so retractor का काम क्या होता है? Retractor is used to retract the tissue to get a clear film. ठीक है? So retractor is used to retract the tissue, and this is a self-retaining retractor. It can be fixed with screws. So this one is which retractor? This one is which retractor? Jaw thyroid retractor. Whereas the other self-retaining retractor is used as this one. This is just a surgical self-retaining retractor. This is a surgical self-retaining retractor. Whereas apart from this, we can also have multiple other retractors which are to be hold. In terms of काम, बस retractor पकड़ना, ठीक है? So these are to be done. So the other various retractors, the first one over here, which has a broad. This one is the Morris retractor. The broad base किसका होता है? Broad base is for the. So broad square base is for the. Morris retractor. Next one, this has to be held. Okay. Next, a D-shaped retractor is D-shaped retractor is D-verse retractor. D-shaped retractor is D-shaped retractor is D-shaped retractor is. Next, this one, which has a increased convexity. So very high convexity is seen in which retractor? Very high convexity is seen in which retractor? Increased convexity is seen in. So this is a Doyen's retractor. This one is a Doyen's retractor. No issues with this retractors now. याद रखना. Broad square base, increased convexity, D-shape, D-verse. ठीक है? D-verse is a thin one, Doyen's is a broader one. ठीक है? ऐसे याद रखना. Next, these are important, which has been asked in the examination also. So these are tissue holding forceps, right? They are used to hold some tissues. Okay? So there are different tissue holding forceps that we have. So normal tissue holding forceps look like this. Okay? Ab samajh jao. Okay? So it can be either a non-tooth forceps, which is used to hold some smooth structures, and there are tooth forceps which are used to hold some tough structures. So normal forceps to pata hai na, that is why I am not included it over here. Tissue holding normal forceps, right? But these are different forceps which also have a ratchet. What is this called as? So ratchet is for locking the forceps. Okay, ratchet is for locking the forceps. So these tissue holding forceps with a lock system or a ratchet, these are two types. Important, दोनों image आ चुकी है. The first one, which has a fenestrated end. So there is a curved end with holes at the end. Curved end with fenestration. So curved end with fenestration is called as the. Curved end with fenestration is called as the. Babcock's forceps. Okay, curved end with fenestration is called as the Babcock's forceps. This is which one? Babcock's forceps. O आ रहा है उसमें तो O याद रखो, O से fenestration होता है. ठीक है? So Babcock's forceps. It is used to hold delicate structures or tough structures. It is used to hold. They have asked you which structures like ureter, structures like bowel, or structures like common bile duct, Any tubular delicate structure is to be held with which forceps? Any delicate tubular structure is hold with which structure? It is a Babcock forceps. Next one here you can see again it is a tissue holding forceps, but it has a curved end, but this is a tooth end. It has some tooth and sharp edges at the end. Okay. So if there is a tooth end of a tissue holding forceps, this is called as which forceps? Alice forceps. And Alice forceps is used to hold which structure? Tough structures. Alice forceps is used to hold which structure? Alice forceps is used to hold which structure? Structures like the skin, structures like the fascia, structures like the tendon, structures like the tendon, and structures like the aponeurosis, structures like the aponeurosis or rectus abdominis muscle. ठीक है? So याद रखना. So for delicate structures we use which forceps? Delicate structures which forceps? Delicate structure which forceps? Tough structures which forceps? Tough structures which forceps? तो stand किसका होता है? Penetrated and ureter, CBD and bowel, skin, fascia, tendon, aponeurosis. No issues with this, anybody? Moving further. Then this one is also a retractor, which we forgot. Okay, used for holding skin or any of the structures, like in cases of hernia surgeries or in cases of any ENT surgeries also we can use this. And this one is which retractor, anybody? Very good. So it looks like a L, therefore this is a lag and back retractor. So this one is a, so this L shaped is a, it has a long handle. So this is a, ये important है. This one is a, so this one is a long handle L-shaped retractor है. Long handle L-shaped retractor है. Lag and back retractor. नाम पता होने चाहिए mainly. ठीक है? वो कुछ भी पूछ रहे. DCR पंच पूछ रहे तो वो कुछ भी पूछ सकते. ठीक है? So important. And the last image, that is, this is a proctoscope. This is a proctoscope. This is a proctoscope. Proctoscope can also be called as a rectoscope. It can also be called as a rectoscope because it is used to visualize rectum. It is used to visualize the rectum. So proctoscope is used for examination of rectum. Proctoscope is used for examination of rectum. Mainly for which purpose? Hemorrhoids. Mainly for hemorrhoids. Okay, you insert this proctoscope with jelly on it and then you remove this. Okay, then you remove this one. Okay. So important. No issues with this. First, you will perform a digital rectal examination or a per rectal examination. After that, you will perform a proctoscopy or a rectoscopy. It is done for hemorrhoids. No issues with this. Yaad rakhna. Proctoscopy is contraindicated in which anal condition? Fissure. Proctoscopy is contraindicated in. अगर करना भी चाहोगे, जो लात पड़ेगी बेटा. Because in digital rectal examination only the patient has extreme pain during anal fissure. Okay? So you just retract the anus and see there is a skin tag which is seen. You suspect anal fissure. Okay? And then you do not perform proctoscopy. गलती से भी मत कर लेना. ठीक है? कुछ नहीं होगा जनरल एनेस्थीसिया. Then this one. This is what? These are towel clips. These are towel clips. So we use the green colored surgical drapes, right, to isolate the surgical site, right? And for this fixation of the surgical drapes, you use this towel clips. ठीक है? Clips की तरह काम करती है, चिमटे की तरह. ठीक है? So they will fix the surgical drapes. These are what? Towel clips. Then next one. This one is what? This one is a artery forceps. This one is a artery forceps. It is used to clamp the vessels. It is used to clamp the vessels. It is used for achieving hemostasis. No issues with this. Yaad rakhna. It also has a locking end that is called as a ratchet, and it has fenestrated ends. Okay, it has fenestrated ends. No issues with this. So artery forceps is used for hemostasis. No issues with this. We also have a needle holder, something like this only. Okay, so differentiate it from a needle holder. This one is what? A thick scissors used to cut tough structures. It is known as the Mayo scissors. A thick scissor used to cut tough structures is known as the Mayo scissors is used to cut. So it is a thick scissors which is seen and it is used to cut tough structures. So this scissors is known as Mayo scissors. Then next, सबको पता है. This one is a Humbee's knife. This one is a image आ चुकी है. This one is a Humbee's knife, and Humbee's knife is used to take a partial thickness or a full thickness skin graft. It is used to take a partial thickness skin graft. And skin grafting is usually done after burns. Skin grafting is usually done after. Skin grafting is usually done after. And for partial thickness skin graft, which instrument is used? For partial thickness skin graft, which instrument is used? For partial thickness skin graft, which instrument is used? Nowadays, we can also use the electrical dermatome. We can also use the electrical dermatome. And for full thickness skin graft, we can use the, for a full thickness skin graft, we can use the, which blade, anybody? Wolfie's blade. For full thickness skin graft, we use the, for full thickness skin graft, we use the, for partial thickness skin graft, we use the, partial thickness, full thickness, and electrical dermatome can also be used. Okay, no issues with this. आगे देखते हैं. Next, this instrument commonly used, curved end है बहुत ज़्यादा. This is known as the cheatal forceps. This is known as the. So this cheatal forceps would usually be placed in a dressing tray. Okay, it is dipped in an antiseptic solution, and क्या काम होता है? It is only used to pick up some sterile instruments, like it is used to pick up some sterile gauze or sterile pad from the drum. ठीक है? So you cannot directly touch it. Even on wearing gloves, you cannot touch it because you will become unsterile. So before wearing gloves, you can use this cheatal forceps and remove the gauze pads or gauze pieces. ठीक है? So it is used to remove. Gauze pieces. What is this forceps known as? Cheatal forceps. No issues with this. Next. Then if I talk about this one, what is this? Important. ये question आ चुका है. Image आ चुकी है. Very good. Bolo. It has penetrated ends again. Okay. It also has a penetrated ends or holes at the end and a ratchet or locking system. These are which forceps? Very good. These are known as Rampley's sponge holding forceps. These are known as Rampley's. So sponge holding forceps पूछा गया था, नाम नहीं पूछा था, but at least important. If it has a penetrated end and not a curved end, only penetrated end is known as which forceps? Only a penetrated end is which forceps? So it is used to hold any sponge or maybe your cotton swab while you clean the abdomen. Okay? So for cleaning the abdomen with COVID and iodine solution, you dip the cotton swab, you hold the cotton swab with this forceps, you dip it in COVID and iodine and then clean the abdomen. Okay? So these are which forceps? So penetrated ends with plain ends is Rampley's sponge holding forceps. So these are sponge holding forceps used to hold cotton swab. No issues with this. Then next one. This one is what? So it has penetrations for a better grip. So these are penetrations for a better grip, and this is the place to mount a blade. So this is actually a blade handle which is used. Okay, here you can mount a blade. At this end you can mount a blade, and this is known as which handle? PP handle, also known as barred Parker handle. This is known as which handle? And barred Parker handle is used for mounting of. So normally blade हम directly ऐसे ही cut करते हैं, but अगर US वगैरह हो तो they will use this barred Parker blade, या कोई private hospital हो. सरकारी में तो ऐसे ही काम चला. Next, these are number of blades. Images दो की आई थी बस, 11 and 12. ठीक है? So the 11 number blade is important. Okay, 11 number blade is important. This 11 number blade is called as stab blade. 11 number blade is called as, and this 11 number blade is used for incision and drainage. Therefore it is important. ये intern का काम है. ठीक है? So stab blade is 11 number blade is known as which blade? It is used to make a stab wound. ठीक है? And it is used for which procedure? Incision and drainage, which you perform for abscesses. ठीक है? No issues with this. Then next, number 12 blade is used for cutting off sutures. Number 12 blade is used for cutting off. So when you need to cut the suture, you use this number 12 blade. This pointed end should be facing upwards. ठीक है? तो ऐसा cut करोगे. ठीक है? बाद में सीख लोगे. And all the other blades are usually used for giving incision. And the belly is the sharpest portion of the blade. ठीक है? No issues with this. याद रखना. Important is number 11 blade, which is also known as stab blade. And stab blade is used for which procedure? cutting sutures के लिए we use the number 12. Then there are some important electrical instruments which are used for either cutting the structures or coagulating the structures, and that is what is known as a cautery. That is what is known as a cautery. आजकल बहुत हम यही use करते हैं, ठीक है? So the first one here you can see the cautery has only single end. So this is called as a monopolar or a unipolar cautery. So the first one is a monopolar cautery. And monopolar cautery, the current will come from the machine to this end and it will pass via the body of the patient and it should go again to the machine. So for that we use the cautery pad. So cautery pad is required for which cautery? Cautery pad is required for which cautery? Monopolar cautery. But cautery pad would not be required for which cautery? Cautery pad is not required for which cautery? Bipolar cautery. So here you can see the cautery has how many ends? 2 ends, and therefore it is called as which cautery? So if the cautery has prong-like ends, okay, there is a bifid end, it is a bipolar cautery. And what is not required? A cautery pad is not required because the current will come from one end and go via the another end. Okay, it will not go from the body of the patient. So if a patient is having a pacemaker, again a recall question. If a patient is having pacemaker, which cautery is contraindicated? Which cautery is contraindicated in pacemakers? So in pacemakers, unipolar or monopolar cautery is contraindicated. Why? Because here the current will pass from the body. So in which, in pacemaker, which cautery is contraindicated? In pacemaker, which cautery is contraindicated? So if a patient is having pacemaker, which cautery is to be used? Bipolar cautery. No issues with this, anybody? Now यहाँ पे तुम बोलोगे दो buttons है. One is the yellow button, other is the blue button. So yellow button is used for cutting. Yellow button is used for, and blue button is used for coagulation. Blue button is used for, yellow for, blue for. No issues with that. So unipolar cautery or monopolar cautery has two functions: cutting and coagulation. But bipolar cautery can only coagulate. No issues with this. फंडे समझ गए? इतना ही आता है cautery से, इसके अलावा कुछ नहीं आएगा. Image, pacemaker वाला question, cautery pad वाला question, या cutting और coagulation. इससे आगे कुछ नहीं. Next, if I talk about the suture types, ठीक है? So first, if I take one suture, tie the knot and cut it. Again, if I take the second suture, tie a knot and cut it. So these are known as simple interrupted sutures. One suture, tie the knot. Another suture, tie the knot. Okay? This is known as which suture? So this is known as simple interrupted sutures. But if I take the needle from one end and then continue the sutures, this is called as simple continuous sutures. These are called as simple continuous sutures. No issues with this. Here I will not tie the knot after every suture. Here I will keep on taking the suture and at the end I will tie a single knot. Okay? That is known as continuous sutures. Let me know higher chances of slippage of ligature are seen with. Highest chances of slippage are seen with. Simple continuous sutures. Next one, here you can see these are mattress sutures. That means you take 1 centimeter away से निकालोगे. Then you take 1 millimeter away से निकालोगे. That means, so here if this is the wound, ठीक है? So here you will take from 1 centimeter away the wound and you will remove 1 centimeter away from the wound. ठीक है? Then you will again go 1 millimeter from the wound and you remove 1 millimeter from the wound. ठीक है? So double time ले रहे हो. 1 centimeter away से ले रहे हो, निकाल रहे हो. 1 millimeter away से ले रहे हो, निकाल रहे हो. ठीक है? So two sutures are taken. This is called as which sutures? ये बाद में सिखा देंगे तुम्हें. This is called as mattress sutures. These are called as mattress sutures. So mattress sutures can be either horizontal mattress or. So if suture length थोड़ी बहुत दिखती है, then it is a horizontal mattress. If suture length is visible, it is a. If suture piece is visible, it is a. If suture piece is visible this way, it is a vertical mattress. ठीक है, no issues with this. Suture piece visible horizontally, horizontal mattress. Suture piece visible vertically, it is a vertical mattress. ठीक है, ऐसे image देखनी है, image important है. And these are running subcutaneous sutures. So subcutaneous sutures also called as subcuticular sutures. Subcutaneous sutures also called as subcutaneous sutures also called as subcuticular sutures. And they have one task, which is the best suture material used for subcuticular sutures. So subcuticular sutures are done usually when we need a very good approximation. ठीक है, maybe face sutures हो गए या और कोई cosmetically better outcome चाहिए. So we take this kind of sutures, subcuticular sutures. They have a better cosmetic outcome. ठीक है, so subcuticular sutures are done with which kind of suture material? The best suture material used for subcuticular suture is monocryl. The best suture material used for subcuticular sutures is best suture material used for subcuticular sutures is best suture material used for subcuticular sutures is monocryl. No issues with this. याद रखो. Next, if I talk about suture materials now, images आ चुकी है. All these three have come in the examination. The first one, yellow colored suture is a catgut suture. First one is a catgut suture. And so please remember, sutures को needles attached होती है. ठीक है? So catgut suture is there. So catgut suture is derived from. It is derived from which layer of gut? Mucosa or submucosa? It is derived from. It is derived from submucosa of gut of which animal? Submucosa of sheep gut. Submucosa of. So catgut is derived from. So ये important है. Though the name is catgut, it is derived from submucosa. It is derived from submucosa. It is derived from submucosa. This was a recall question. Catgut is derived from submucosa. Submucosa. Sheep gut के कौन से layer से? Sheep gut के कौन से layer से? Because the strongest layer in the gut is humans में भी same है. Strongest layer in the gut is submucosa because it contains collagen. ठीक है? Catgut is a absorbable suture or a non-absorbable suture? Catgut is a absorbable suture. It absorbs within how many days? It absorbs within 60 days. ठीक है? It is a natural suture or a synthetic suture? So it is a natural suture because it is derived from sheep gut submucosa. No issues with this anybody? Important चीजें पता चल गई catgut. Next, this violet colored suture, V for violet, V for vicryl suture, V for vicryl या vicryl जो भी बोलो, V for vicryl suture. And this vicryl suture is a synthetic or a natural one? So it is a synthetic suture. It is a synthetic suture. That means it is man-made. ठीक है? And it is a absorbable or non-absorbable suture? So it is a absorbable suture. It is a absorbable suture. And it is absorbed within how many days? 60 to 90 days. It is absorbed within how many days? So vicryl is absorbed within. It is a natural or synthetic? Synthetic suture. Which color? Violet color. So violet color, vicryl suture. No issues with this anybody? Synthetic absorbable suture absorbed within 60 to 90 days. And it is used for submucosa. It is used for submucosa. ठीक है? It is not used on skin वगैरह. It is used for submucosa and muscle layers mainly. ठीक है? Inside. Next, this black color suture. It is a very good. It is a silk suture. The black color suture is a. So black color suture is a natural or synthetic? Silk is derived from silkworm. Therefore, it is a. So silk is a natural suture. Okay, it is which color? Which color? Black color. No issues with this. याद रखना. It is absorbable, non-absorbable. So it is a non-absorbable suture. Silk is a non-absorbable suture. Natural non-absorbable suture. No issues with this. Important. So non-absorbable है. तो वैसे भी absorb होने का तो time limit है नहीं कुछ. Now important. Silk sutures are usually used for skin. Silk sutures are usually used for S for S. Silk sutures are used for skin. No issues with this. And important thing, there are some monofilament sutures. Monofilament made up of only single thread, and braided sutures or polyfilament sutures made up of multiple threads. Silk is a monofilament or a braided suture? Silk is a braided suture. No issues with this. याद रखना. And if there is a braided suture, there would be higher chances of infection. Braided sutures में there are higher chances of braided sutures में there are higher chances of braided sutures में there are higher chances of. No issues with this. Now important one or two things. First is the Jenkins rule. What do we mean by the Jenkins rule? Anybody? So, okay, Jenkins rule means, okay, wound length is to suture length should be. Very good. Wound length is to suture length should be. Wound length is to suture length should be. So if 1 centimeter is the wound length, suture length should be 4 centimeter. 1 centimeter is the wound length, suture length should be 4 centimeter. So this is what is the Jenkins rule. Okay? So Jenkins rule क्या होता है? Wound length is to suture length. Ratio should be. Wound length is to suture length. Ratio should be. Wound length is to suture length. Ratio should be. And this is called as which rule? This is called as which rule? Jenkins rule. Okay? No issues with this. Now important और एक question आया था. Needle is held with a needle holder. ठीक है? ये तो पता है ना. Needle is held with a needle holder. So this one is a needle. ठीक है? Sorry. Shape के लिए माफी चाहता हूँ. ठीक है? So this one is a needle holder which will have a broad end. So this broad end is called as the swaged end. Broad end is called as the swaged end, and the other one is a pointed end. Other one is a pointed end. So where do we hold the needle? Where do we hold the needle? 1/3 from the swaged end. 1/3 from the and 2/3 from the 2/3 from the. So needle holder is held. We will hold the needle at 1/3 from. We will hold the needle at 1/3 from. We will hold the needle at 1/3 from and 2/3 from. 2/3 from. 1/3 from. So at junction of posterior 1/3 and anterior 2/3 बोल सकते हो, या 1/3 from swaged end and 2/3 from pointed end. We hold the needle. This was a question which has been asked. Where do you hold the needle? ठीक है, वो उसी के साथ खेल गए. 1/3 from swaged, 2/3 from swaged, all of this. ठीक है, तो याद रखना. No issues with this, anybody? Then if I talk about this, before that just let me know. एक से दो important चीजें पूछ रहा हूँ बस. When do we remove sutures on scalp? When do we remove the scalp sutures? 5 to 7 days. Scalp sutures are removed within. Scalp sutures are removed after. Scalp sutures are removed after. Scalp sutures are removed after. Face sutures are removed after 3 to 5 days. Face sutures are removed after. Face sutures are removed after. Face sutures are removed after. And last बता दो, thorax sutures are removed after 10 to 12 days. Thorax sutures are removed after. Thorax sutures are removed after. ठीक है, abdominal 12 to 14 days है. Neck it is again 5 to 7 days. ठीक है, so important ये तीन at least. Scalp sutures are removed after. Face sutures are removed after. And thorax sutures are removed after. No issues with that. Important. Then if I talk about the knot of sutures, if both the ends are either upward, if both the ends are either upward or both the ends are either downward, this is called as which knot? Square knot is also known as reef knot. Square knot is also known as Whereas if one end is upward and the other end is downward, this is known as a. This one is known as a image आ चुकी है granny's knot की. ठीक है, this one is a granny's knot. No issues with this. And the most important and the most secure knot is a surgeon's knot. That means 2 throws followed by 1 throw. Two throws followed by 1 throw. So it is a 2 throws followed by 1 throw. It is a most secure knot is a. Then square या reef knot is also a secure knot. The only insecure knot is. Therefore, it can easily slip. So which knot should not be used? Because it can easily slip. Because it is a insecure knot. ठीक है, knots के easy है. ठीक है, no issues with this. And lastly, please tell me if there is a circular wound. We can apply these kind of sutures. These are called as. So to bury the base of the appendix, we can use these kind of sutures known as. These are called as purse string sutures. These are called as. दादी जी की पोटली जो होती थी ना, तो उसके तरह होता है sutures. You take the suture and then just pull them. Okay, they will bury the opening or bury the base. ठीक है? So these kind of sutures are first string sutures. No issues with this. First string नीचे में पूछे जा चुके हैं एक बार इससे. Next type of lesions now. ठीक है? Forensic से भी important है, surgery से भी important है, बाकी भी. The first one here you can see there is only injury to the epidermis. There is only injury to the, and this is which type of lesion? This is a abrasion. This is a abrasion. So linear lesions are seen. These are called as abrasions. There is only injury to the epidermis. Abrasions are also called as graze. Okay, abrasions are also called as graze. And in RTA there can be a very wide abrasion known as a gravel rash. It is known as a gravel rash or a brush burn or a friction burn. So these wide abrasions are called as gravel rash. Forensic का question है. Wide abrasions are called as gravel rash, brush burn or friction burn. ये question था. ठीक है? A wide abrasion was given and they asked you what is this type of lesion called as. This type of lesion usually seen after a RTA is called as gravel rash, brush burn or friction burn. Gravel rash, brush burn or friction burn. No issues with this. So abrasions are usually due to friction with the irregular surface like roads. ठीक है? If there is some tissue loss, skin loss, subcutaneous tissue loss. So tissue loss is seen in. So laceration में important finding क्या है? So laceration somewhat looks like incised wound. So how to differentiate? Lacerations will have what kind of margin? Lacerations will have irregular margin. And second, the blood vessels and the nerves. Okay, the blood vessels and the nerves at the lesion would be cut or crushed. The blood vessels and nerves are and margins would be this type of lesion is laceration में there is loss of tissue. So there would be injury to the skin, subcutaneous tissue, epidermis, dermis as well. ठीक है? Next, this one image आ चुकी है. This one is which injury? This is a degloving injury. This one is a degloving injury, and degloving injury is also called as avulsion. Degloving injury is also called as avulsion is also called as degloving injury. And here you can see a flap is created. What is created? A flap is created. Therefore, it is called as avulsion or a degloving injury. ठीक है? Important question जो FMG में आ चुका है, recall based. Separation. When a motorcycle runs over the hand, then this type of degloving or avulsion injury can be seen. ठीक है? Important cause, mechanism of action. Important question जो recall था, and most of us marked it wrong. Separation in degloving or avulsion injury occurs at which level or which plane? It occurs between the subcutaneous tissue and deep fascia. Between subcutaneous tissue and deep fascia. So in avulsion injury or degloving injury, the separation occurs between अगर ये कलर फॉन्ट कलर विजिबल नहीं हो, प्लीज लेट मी नो. ठीक है? नो इश्यूज विद दिस. आगे नेक्स्ट, हियर यू कैन सी शार्प कट्स, and sharp cuts are usually seen with sharp edge instruments like surgical blades, knife वगैरह. ठीक है? So these sharp cuts with which kind of margins are seen? Regular, irregular. So here you can see regular margins. So sharp, clean cuts with regular margins are what? Which type of wound? So these are which type of wound? Incised wound. These are which type of wound? Incised wound. Okay? And multiple cuts. ये अभी का आईना सीटी का भी क्वेश्चन है. पता नहीं क्यों पूछते हैं, उनको क्या प्यार है. So ज़्यादा सुसाइड कर रहे शायद. So this type of sharp cuts given on accessible areas. These are known as which cuts? Hesitational cuts. These are known as hesitational cuts. Also known as tentative cuts. अंदाजन मारे हुए. Also known as suicidal cuts. Also known as मरना होता नहीं है, फालतू में मारता है. ठीक है? तो hesitational cuts, tentative cuts और suicidal cuts are multiple cuts on accessible parts of the body ठीक है, with sharp instrument, therefore they will have regular margin. पापा की परियों का कट. Next, this which is seen at the end, guys please शांत हो जाओ थोड़ा, बहुत मजनू भी करते, ठीक है, रहने दो. हाँ. Now, at the end of the incised wound, which kind of what is seen at the end of the incised wound? What is seen? Fish teething. At the end of incised wound, which is what is seen? At the end of incised wound, what is seen? So this is important. This was marked and it was asked, what is this? So at one end of incised wound, we can see fish teething. Next one. This one is what? This one is a bruise or contusion. This one is a bruise or, so bruise is also called as, contusion is also called as a, and bruise or contusion is due to rupture of venues. It is due to rupture of, so bluish, reddish, blackish discoloration in any area. It can also be an artificial bruise. Forensics is important. Plant irritants can be used, right? Right? Abrus precatorius, kunchi seeds, or forensic padlore. Important. Next one. If I talk about this, this is what, this one is the it is a nail injury. This is a nail injury, and nail injuries are called as which bites? Puncture bites. Nail injuries are called as, an important thing about puncture bites, they will require thorough or aggressive cleaning and debridement. They will require aggressive debridement. They will require aggressive, so they will require aggressive cleaning and, ठीक है, याद रखना. If it is a puncture wound due to any nail injury, you need to wash the wound thoroughly and also do debridement in the patient. ठीक है, if debridement is required. हर patient में नहीं करोगे तो, and also give IV or any oral antibiotics to the patient. No issues with this, to prevent any bacterial infection. Next one, this one is what? So in cases of a high velocity road traffic accident, the patient can damage the skin, there would be loss of the subcutaneous tissue and also damage to the underlying structure, muscles, bone, tendons, ligaments. If all of them are damaged, this is called as a, so all of the structures are damaged, it is called as, if all structures are damaged, it is called as crush injury. Okay, no issues with this. And this is what is a crush injury, where there would be damage to the blood vessels, there would be damage to the nerves, tendons, ligaments, skin, and even the subcutaneous tissue or the muscles as well. Okay, everything would be damaged. So you need to repair. Need PG में question आता है, in which sequence you need to repair it. यहाँ पे नहीं पूछेंगे, ठीक है? So this was the crush injury. देखो कैसा था. First of all, you need to debride the wound properly, and then you perform a skin graft. First of all, you need to debride the wound. You need to repair whatever is injured. That is your blood vessel, artery, veins, nerve, extensors, flexor tendons. Okay, all of these are to be repaired, and then you perform a skin flap reconstruction or a skin grafting surgery. Okay, no issues with this. So this is what is the art. Okay, this is called as the art or beauty of surgery, and the artist is actually a surgeon. Okay, medicine wale cannot understand this. The next one, this one usually, this is which type of a region? This one is a pressure sore, also called as a bed sore. Pressure sore, also known as a bed sore. Okay, important. The most common site of pressure sore. Here you can see there is damage to all the structures. There is granulation tissue bhi thoda bahut dikh raha hai. All these healthy granulation tissue is seen. There would be oozing out of blood or oozing out of some discharge. Okay, the most common site would be sacrum. दिया इसका मतलब sacrum नहीं है. Recent जो ये है, अरे recent findings sacrum से ज्यादा और common बताता है. Buttocks, it is the ischium. ठीक है, most common site is the ischium. Bed के क्या हो जाता है, ठीक है. And अगर if the patient is bedridden, then the most common site would be, कोई दिक्कत है, कुछ और लिखवाया किसी ने? नहीं ना? So here, this kind of lesions are called as pressure sores or bed sores. These kind of lesions are called as pressure sores or bed sores. And the most common site for pressure sores is मोस्ट कॉमन साइट फॉर प्रेशर सोर्स इज एंड फॉलोड बाय heel, ठीक है, followed by third most common is heel usually, ठीक है. No issues with pressure source or bed source. Last time वो googly question था and these questions can come this time also. Nobody can assure of that. They have asked you at what pressure usually pressure source develop. So the maximum pressure given was, I feel, more than 20 mm of FG it was given, or more than 30 was given, I feel. That was to be marked for pressure source, ठीक है. So maximum pressure mark करो, ठीक है. Next, if there is a wound, important thing about the wound, please let me know. If I talk about a wound, guys, there can be tidy wounds which are clean, which are not contaminated, and there can be untidy wounds like a road traffic accident में जो होता है. Now, for if an untidy wound is there, the tidy wound will heal with primary intention, but an untidy wound does not heal with primary intention unless and until it is what should be done? Debridement should be done. What should be done? Debridement. Removal of the dead or the necrotic tissue is known as debridement. This was the question. Debridement की definition पूछी थी. Removal of dead or necrotic tissue is called as debridement. So wound के लिए untidy wound. Which type of wound requires debridement? Which type of wound requires debridement? And the golden period of wound in which debridement should be carried out is the golden period for debridement is 6 hours. No issues with this. This was a question. Golden period for debridement is 6 hours after the wound. Okay? So debridement is carried out for untidy wounds. Then, if a wound is there, it will form granulation tissue and then finally it will form a scar. So it will heal by forming the scar. And what is a scar? Scar is nothing but due to deposition of collagen and fibroblast. It is due to deposition of collagen and so what is a scar? Deposition of collagen and fibroblast. Important question जो मैं पहले पढ़ा चुका हूँ साथों में. The first collagen to appear during wound healing is सब साथ के नाम बता दो. First collagen to appear during wound healing is collagen 3. First collagen to appear during wound healing is then it is replaced by collagen 1. Okay, no issues with this. Then if I talk about scar, definitely this scar, okay, if there is a bad or adverse scar, that means there is excess deposition of this collagen or fibroblast, it would lead to formation of a bad scar or a adverse scar. These are two examples of a bad scar or adverse scar. Okay, the most common one out of these two is hypertrophic scar. Most common one is the rare one is the so in both these scars, these are adverse or bad scars. That means both of these are due to over deposition or excess deposition of collagen and fibroblasts, and so excess deposition of these can lead to either a hypertrophic scar or a keloid scar. So how to differentiate? If the scar is within the wound limit, it is called as if the scar is within wound limits, it is called as if the scar grows beyond wound limits, it is called as if a scar grows beyond wound limits, it is called as, and it will grow beyond wound limits in which fashion? Claw manner. Okay, it will grow beyond wound limits in which fashion? Claw-like fashion. Okay. Then children में which type of scar is seen? Children में we can see a adults में we can see a, not always, in adults also we can see a hypertrophic scar, but in some cases keloid scar can be seen in adults. Most common is hypertrophic in children as well as adults, but keloid scar is not seen in children. Okay. Females में which is common? Keloid. Okay, hypertrophic is equal in males and females, but keloid is more common in and which is associated with black race. Again, keloid is more common in which race? Familial is which one? Familial means genetic. Familial is मैं तो बच्चा हूँ, अच्छा फिर भी हो गया. अरे हो जाता है कभी कभी, एक्सेप्शन तो हर जगह होता है. So familial predisposition or genetic predisposition is which scar? Familial predisposition is with scar. No issues with this. इस पे questions आ चुके हैं scars पे. Hypertrophic की image last December में आई थी, and before that keloid images have come and all these questions have been asked. ठीक है? No issues with this. Within one limit, hypertrophic. Beyond one limit, keloid. Familial, black race, females, children, hypertrophic. No issues with this. Now, for hypertrophic scar, nothing is to be done. It can be left as it is. Moisturizers can be applied. For keloid scars, here commonly we use what? For keloid, the treatment would be normal. Commonly treatment done is very good. Intrakeloidal injection or intra-lesional injection. So intrakeloidal injection of which steroid? Intrakeloidal injection of triamcinolone. Intrakeloidal injection of, so which is the most common treatment done for keloid? Intrakeloidal injection of injection triamcinolone within the keloid scar. But if they ask you which is the best treatment, this was asked earlier. So best treatment for keloid is excision followed by radiotherapy. Excision followed by, so best treatment for keloid is excision and so radiotherapy with cobalt is given to prevent any recurrence at the site. Okay? Because recurrence is very much common in keloid scars. So एक बार निकालोगे कुछ नहीं होगा. Therefore, you prefer giving a cobalt radiotherapy in the patient. So most common treatment is injection of, but the best treatment is excision and no issues with this, guys. याद रखना. Next, this image can come. At least image याद रख लो, बाकी नहीं पीछे में आता है. What is this image? A patient underwent a laparotomy surgery. For laparotomy, as I hope all of you are quite aware, in emergency laparotomy surgery, we don't give a paramedian incision. We give a midline incision to get a better access to the organ. And this midline incision is associated with high risk of rupture. This is called as burst abdomen. This complication is called as, and it is associated with which surgery? Emergency laparotomy. It is associated with which surgery? Emergency laparotomy. It is associated with a which incision? Midline incision. It is associated with a midline incision. ठीक है? समझ गए ये? कोई दिक्कत नहीं है. Burst abdomen है, usually occurs on post-operative day 5 or 6. ठीक है? Commonly. ठीक है? No issues with this. And it can also be due to multiple other causes. There can be some patient-related causes like malnutrition. There can be obesity, diabetes mellitus, or multiple other diseases in the patient, like Ehlers-Danlos syndrome or any other collagen diseases in the patient. Or it can be due to surgical causes if the wound tension was very high. Therefore, the sutures just separated or the sutures just slipped off. Or if there was a Granny's knot which was applied or an insecure suture was taken. Okay? All of these can be the causes of burst abdomen. No issues. And most common cause is definitely infection. Okay? Infection, they can cause burst abdomen and there would be serosanguinous discharge and this red granulation tissue would be seen. Next, if I talk about surgical wounds now, guys. So surgical wounds are classified as 4 classes of wounds. Class 1 are clean wounds. Class 2 are clean contaminated wounds. Class 3 are contaminated wounds. And class 4 are dirty wounds. Okay? So how to talk about this? First one is the clean wound. It is usually done in cases of, seen in cases of when we give a clean incisional cut. Okay, it is usually seen in clean surgery. Like hernioplasty. In surgeries like hernioplasty. Which hernia? When it is not infected. Yaad rakhna. Any structure which is not infected and we perform a clean surgery, it is a class 1 wound. That is a clean wound. Then clean contaminated wound. Here it is usually a elective gastrointestinal or a genito-urinary surgery. Gastrointestinal or genito-urinary surgery. Elective means the bowel was prepared earlier. The organs was prepared earlier. They were empty. They do not contain any fecal matter or any other inflammation is not there. Right? So elective surgeries which are planned, that would be which type of wound? Clean contaminated wound. So elective GI or GU surgeries would be clean contaminated wound. Then if there is contamination, then it would be a contaminated or a class 3 wound. It would be emergency gastrointestinal or genitourinary surgery. So emergency GI or GU surgeries are contaminated wound. Okay, there can be a risk of spillage of the fecal matter into the peritoneum, or maybe there is a spillage of any intestinal content, or maybe there is a inflammation also. There is a inflammation, but which type of inflammation? Non-purulent one. And dirty, these are usually abscesses. Or any pus containing infection, All abscesses are which type of wound? So any abscess or pus containing wound would be dirty wound. Purulent inflammation would be a dirty wound, but a non-purulent inflammation would be a contaminated one. Okay? So in class 1 or clean wounds, antibiotics are given or not? So before surgery, we can give prophylactic antibiotics to prevent any infection. And after surgery, for treatment of infection, we give therapeutic antibiotics. Okay? In clean, we can we give antibiotics? Shall we give antibiotics rather? So no need of antibiotics in clean wounds. Okay, no need of antibiotics in clean wounds. In clean contaminated, we will give prophylactic antibiotics. In clean contaminated, we will give. Whereas in class 3 or class 4, that is contaminated and dirty, here we will give prophylactic plus therapeutic antibiotics. Here we will give prophylactic plus. No issues with this. Antibiotics are not given in clean wounds. Prophylactic antibiotics are given in clean contaminated wounds. And prophylactic plus therapeutic antibiotics are given in contaminated and dirty wounds. Easy? Okay? यही लॉजिक. हर सर्जरी से पहले नहीं देते यार, मतलब क्लिनिकल प्रैक्टिस में दिए जाते हैं यूजुअली, ठीक है, बट नॉट बिफोर लाइक माइनर सर्जरी. हाइड्रोसील करना है, हर्निया करना है, उसके पहले यूजुअली नहीं देते हैं unless and until there is some inflammation which is associated in the patient. ठीक है, तो usually clean surgeries में no need of antibiotics as such, prophylactic. If you feel the need, clinical ये होता है, तुम्हारा decision होता है. If you feel the need, then देता हूँ ब्रेक. रुक जाओ, 1.5 घंटे में ब्रेक चाहिए यार तुम्हें. अभी जाके आए हो तो एग्जाम में नहीं जाने को मिलेगा, ठीक है. सुट्टा उट्टा सब बंद होगा एग्जाम में, ठीक है, तो आदत लगा लो. नाउ इफ आई टॉक अबाउट ट्रॉमा इन अ पेशेंट, ठीक है, इफ आई टॉक अबाउट ट्रॉमा इन अ पेशेंट, सी याद रखना इंपॉर्टेंट है. ट्रॉमा के बारे में अगर मैं बात करूं, डेफिनेटली द एडवांस ट्रॉमा लाइफ सपोर्ट लाइक दैट ATLS प्रोटोकॉल वुड बी एक्टिवेटेड, ठीक है. एंड व्हाट इज द ATLS protocol for trauma? The sequence would be ATLS protocol के sequences ABCD या CAB? ATLS protocol के sequences ABCD. ATLS protocol के sequences airway, breathing, circulation and disability management. A for airway management, B for breathing management, C for circulation and D for disability management. ठीक है, no issues with this, याद रखना. Whereas for cardiorespiratory arrest that we saw in CPR guidelines according to BLS or ACLS, there the sequence was CAB. So in cardiorespiratory arrest the sequences, but in ATLS protocol the sequences, and D for disability management. ये question ही important है, ठीक है. CAB मार्क मत करना trauma में. Now if I talk about trauma, definitely a patient met with a road traffic accident and now there is a huge blood loss in the patient, and the most common complication that can occur to a patient would be shock. And due to excess blood loss, which type of shock is the hypovolemic shock? It is a type of hemorrhagic shock. ठीक है, so hypovolemic shock is one of the important causes of death after trauma in a patient. ठीक है, no issues with this. So hypovolemic shock की अगर मैं बात करूं, hypovolemic shock ये क्लासेस आजकल MCQ में बहुत कॉमनली देखे, इसीलिए मैं डाल रहा हूं. So classes of hemorrhagic shock or hypovolemic shock are based on the percentage of blood which is lost. ठीक है, so if class 1 means how many percentage of blood is lost? 0 to 15%. 0 to class 1 is 0 to class 1 is so 0 to 15% of blood loss. Class 2 is 15 to 30% of blood loss. Class 2 is 15 to 30%. Class 2 is 15 to 30% of blood loss. Class 3 is 30 to 40% of blood loss. Class 3 is 30 to 40% of blood loss. 3 for 3 ऐसे याद रखो, बाकी याद हो जाएंगे. Then class 4 is more than 40% of blood loss. Class 4 is more than 40% of blood loss. In which condition you can give oral fluids to the patient? Only in class 1. 2 में भी हम IV start कर ही देते हैं, ठीक है? So class 1 we can give oral fluid to the patient, but other we need to start IV fluid to the patient. And massive blood transfusion would be required for class 4. Massive blood transfusion is required for class 4. What do we mean by massive blood transfusion? Important. Massive blood transfusion when the whole circulating blood volume is replaced within 24 hours. मतलब एक दिन में पूरा 5 लीटर ब्लड तुमने बदल दिया, ठीक है? That is what is a massive blood transfusion, or half of the blood volume within few hours, ठीक है? No issues with this. So याद रखना, that is what is called as a massive blood transfusion. So massive blood transfusion can lead to many side effects. Most common complication of massive blood transfusion would be most common ट्रैली टाइको हो सकते हैं, most common नहीं है वो. Massive blood transfusion is to be given. For blood transfusion, before blood transfusion, the blood is kept at what temperature? 4 degrees Celsius. So therefore it should be rewarmed. And rewarming is done with the help of a blanket. For how much time? 30 minutes. Maximum 30 minutes. It should not go beyond 2 hours. Otherwise there would be high risk of infections in the recipient. ठीक है? If massive blood transfusion is given, rewarming का time नहीं मिल पाता है, and therefore cold blood is introduced in the patient, and that causes hypothermia. That can lead to hypothermia. Apart from that, there can be dilutional coagulopathy like DIC in the patient. There can be hyperkalemia, hypocalcemia, hypophosphatemia, hypomagnesemia. All of these features would be seen. ठीक है? Metabolic alkalosis initially, metabolic acidosis eventually. ठीक है? So all of these features would be seen in cases of massive blood transfusion. And yes, definitely, as you told about two most important side effects. First is TACO. That means excess of blood volume is given, so that can cause transfusion-associated circulatory overload. Transfusion-associated circulatory overload. It will present with features like CHF. So here there is volume overload. There would be peripheral edema in the patient. There would be puffiness of the face, right? So there would be CHF-like features in the patient in TACO. Whereas the other side effect is TRALI. The other side effect is TRALI. That is transfusion-related acute lung injury. It is transfusion-related acute lung injury. And here, after the massive blood transfusion, the patient will present to you with sudden onset respiratory distress, serious sudden onset respiratory distress, along with hypoxemia and chest X-ray showing ground glass opacities or whiteout lung. This picture is similar to ARDS. This picture is similar to. So TACO is similar to. And TRALI is similar to. It is followed by a massive blood transfusion. ठीक है? तो ऐसी पिक्चर दिखती है, तो you either suspect TACO or TRALI. ठीक है? Important. Then if I talk about blood transfusion or fluid resuscitation in a patient of shock, okay? So which is the best clinical indicator for fluid resuscitation in shock? The best clinical indicator is urine output. ठीक है? No issues with this. Oliguria less than 400 ml per day. Anuria less than 100 ml per day. Shabash. Then if I ask you which is the best indicator, important, which is the best indicator for fluid determination? Fluid determination means how much fluid is required in this patient. That would be decided by, very good. The best indicator for fluid determination is pulmonary capillary wedge pressure. The best indicator for fluid determination is pulmonary capillary wedge pressure. Best indicator for fluid determination is pulmonary capillary wedge pressure. If this is not an option, the other one is central venous pressure, CVP. The other one is central venous pressure. This question has been asked, and this image came. So for measurement of PCWP or for central venous pressure measurement, we can use this type of a catheter which has multiple ports. So multiple ports. This is seen in which catheter? This is known as which catheter? Anybody online? कौन सा? Central line बोलते हैं. Catheter का नाम बताओ. Central line नहीं बोलोगे तुम. It is known as a Swan-Ganz catheter. नहीं पता. It is known as a Swan-Ganz catheter. So it is used for usually central line. Okay, it is used for central line insertion, and with this we can measure two pressure. First is the PCWP, pulmonary capillary wedge pressure. Second is CVP, central venous pressure. They are measured with the help of which catheter? Swan-Ganz catheter, which has multiple ports, and it is used for which line? Central line. If you are not in a shock patient, definitely the peripheral veins would be collapsed, right? The peripheral veins would be collapsed, and therefore you need to get a either an intraosseous access or a central line access. ठीक है? Now important central line पे आ रहा हूँ मैं. Important before that, please tell me that we have discussed already. In a patient of road traffic accident or a patient of hypovolemic shock, in a patient of trauma, minimum which gauge cannula should be inserted? Minimum 18 gauge. Minimum recommended are 14 to 16 gauge, but minimum 18 gauge, not less than that. Minimum 18 gauge cannula. That is which color? Green color. And how many lines should be inserted? 2 IV lines. How many IV lines? 2 IV lines are inserted. No issues with this. Whereas if they ask you which is the cannula recommended for major, which is the cannula recommended for massive fluid resuscitation? Answer is 14 gauge followed by 16 gauge. Orange followed by green. No issues with this, anybody? ठीक है. Now if I talk about central line पहले जल्दी से बताओ. There are 3 sites for central line. Either you can insert a central line in the internal jugular vein. Second is the subclavian vein, and third is the femoral vein. Now please tell me, this was a question. If I talk about central line, guys, ठीक है, थोड़ा सा ये कर लेते हैं. If I talk about central line, important है इसलिए बता रहा हूँ, questions आ चुके हैं. If I talk about central line, maximum risk of infection is seen with which vein? Maximum risk of infection is seen with femoral vein. Maximum risk of infection. Maximum risk of infection. Maximum risk of thrombosis. Maximum risk of thrombosis. Maximum risk of thrombosis. Femoral vein. No issues with this. If I ask you maximum risk of pneumothorax, answer is subclavian vein. Maximum risk of pneumothorax. Maximum risk of pneumothorax. Maximum risk of pneumothorax. No issues with this. Maximum risk of infection. Maximum risk of thrombosis. Maximum risk of pneumothorax. And this was the question. They gave you a classical case of pneumothorax after a central line insertion. So which vein they inserted the central line in? They inserted the central line in the subclavian vein. Classical case आ चुका है. FMG का भी और NEET PG का question है. ठीक है? No issues with this, anybody? Then most commonly we use the internal jugular vein. Most commonly आजकल hospital practice में subclavian ज़्यादा common है, but previously we used to use the internal jugular vein. It is easily accessible there. ठीक है? Then this is what? This is the now after if a trauma patient comes to you or a patient comes to you in emergency with intestinal obstruction or before surgery, you need to keep the patient nil per oral. ठीक है? So definitely, or if the patient cannot take the feeds orally, you need to give the feeds directly into the stomach or into the jejunum. So this is called as nasogastric feeding. This is called as nasogastric feeding, and this nasogastric feeding is done with which tube? Nasogastric tube, and this nasogastric tube is called as Rice tube. Nasogastric tube is called as Rice tube. That is RT. ठीक है? And it has other holes also. ठीक है? Extra holes होता है to prevent any blockage. So if the main hole is also blocked, the fluid can come from other holes also. ठीक है? So no issues. And this is the cap. The rice tube. Please remember, it is available in various sizes. And how to determine the size? It is important. Question आया था. How to determine the size of rice tube? You measure the length of the rice tube appropriate for the patient from the tip of the nose till the ear lobule till the sternum. So how is rice tube size measured? From the tip of the nose till the ear lobule till the sternum. So rice tube size is measured from the tip of the nose till the ear lobule till the sternum till the decision. That is the appropriate size of the rice tube used for that particular patient. Okay? No issues with this. Then if I talk about this position, this is important, guys. RT insertion के लिए position they have asked you multiple times. Rice tube or nasogastric tube should be inserted in which position? First of all, in which position? Sitting position. Which position? Sitting. If the patient is conscious, it should be sitting position. If the patient is unconscious, it can be supine position. Okay? So the recommended position is sitting. Recommended position is sitting position. And the neck attitude should be extension or flexion. So please remember, बहुत लोग कंफ्यूज हो जाते हैं. मैम ने एक वीडियो में बताया है कि फर्स्ट यू नीड टू एक्सटेंड द नेक. Extension of neck is only till the tube enters the nasal cavity. After that, immediately you ask the patient to flex the neck. ठीक है? तो अगर वो पूछते हैं, the answer should be slight flexion of the neck. ठीक है? So it is done in which position? Slight sitting position. In which attitude of neck? In which attitude of neck? In which attitude of neck? Slight flexion of neck. ठीक है? And along with this, you can give a water to the patient to sip, so that it does not enter the trachea, rather it enters the esophagus and goes into the stomach. Okay? So that will facilitate the RT tube insertion. You give water along with it. Okay? Which attitude of neck? Slight flexion, sitting position. No issues with this, anybody? सब समझ गए? ठीक है? Moving further. So ये तो सबको पता यार. ये yes, it is sitting position with flexion. ठीक है? अगर दिख नहीं रहा होगा तो पहले थोड़ा सा ये करोगे कि यार मुंह उठाओ थोड़ा and फिर से flex करो. So that is what is this. Now if I talk about triage, triage is for what? Triage is for categorization or segregation of patient. Triage is for segregation of patient. Dependent on severity सबसे last में आता है. The main is likelihood of survival. The main important is likelihood of survival. The most important is likelihood of survival. It is dependent on likelihood of survival. Severity of injury भी आती है, but it is the least one after likelihood of survival, not the most important. ठीक है? अब याद रखने के लिए यार कलर से डाल दिया, अब देख लो. ठीक है? So highest category is, so highest priority would be given to which category? Highest priority is given to. Then high priority is given to yellow या blue. High priority is given for yellow or blue or then low priority is given for and least priority is given for क्या हो गया? Least priority is given for black. ठीक है? तो याद रखना. Now black category patients are dead patient, also called as moribund patient, also called as unsalvageable patient, So जल्दी से black category are dead patient, moribund patient or unsalvageable patient. This is the least priority. This would be the least priority. Then others would be low priority is these are which patient? Ambulatory patient. These are which patient? जो इधर से उधर घूम रहे हैं, and they will have minor injuries. These patients will have minor injuries and only require dressing or no treatment is required. Next, yellow or blue category. These are high priority. Yellow or blue category are high priority, and these are patients requiring surgery within. Then red category patients are highest priority. And these are patients requiring surgery within or immediate resuscitation. Immediate resuscitation. Surgery within 24 hours. Surgery within 6 hours. Minor injuries. Dead patient. Unsalvageable patient. Ambulatory patient. Moribund patient. Highest category. Highest priority. Least priority. Low priority. High priority. सामने लिखा है, चश्मा लगा लो कुछ नहीं. हाई प्रायोरिटी येलो और ब्लू. ठीक है, नो इश्यूज विद दिस एनीबॉडी. इंपॉर्टेंट है. अरे 2.5 घंटे तो बैठे, एग्जाम आ रही पास में. एग्जामिनर नहीं छोड़ेगा. वॉशरूम में नहीं मार सकते, अलार्म होता है. Now, next one, guys. What is the sequence of ATLS protocol? Sequence of ATLS protocol is airway management, followed by breathing management, followed by circulation, followed by disability management. Right? Important. Now, important. Please tell me. Usually, now according to the recent ATLS guidelines, the major causes of death in trauma patient, they have important given it. So, what are the major causes of death in a patient? Airway causes can be like airway obstruction. First can be airway obstruction. Second, it can be pneumothorax. Second, it can be open or tension pneumothorax. Second is open or tension pneumothorax. Third, it can be tracheobronchial injury or tracheobronchial rupture. Tracheobronchial injury or tracheobronchial rupture. Then massive accumulation of blood within pleural cavity. क्या बोलते हैं? Hemothorax. So massive hemothorax. ठीक है? Apart from that, acute circulatory arrest. And important cardiac cause, that is cardiac tamponade. ठीक है? All of these are important causes of death in a patient of trauma according to the recent ATLS. So all of these should be managed first. ठीक है, याद रखना. No issues with this anybody. So A for airway obstruction. Next is pneumothorax. Third is tracheobronchial. TV मत पढ़ लेना भाई. It is tracheobronchial injury. Next is massive hemothorax. Next is acute circulatory arrest. And last is cardiac tamponade. All of these are important causes of death in ATLS protocol. So airway management के लिए you need to remove any obstruction from the airway, and the neck should be flexed or extended. The neck should be extended. The neck should be extended with head elevation. 30-degree head elevation करते हैं. And jaw thrust and chin lift. Is done. ठीक है? Then breathing तो पता ही है हमें. किससे देते हैं? Thank God. Mouth to mouth आ जाएगा. So breathing, mouth to mouth is the last option. The first preferred one is ambu bag. The first preferred is a bag and mask configuration with ambu bag. Apart from that, we can give definitive air breathing management with IPPV. What is IPPV? Intermittent positive pressure ventilation. IPPV is intermittent positive pressure ventilation. Circulation management would be done with IV fluids can be given, and if required, massive blood transfusion would be given to the patient. ठीक है? And disability management, if it is a cervical spine injury, if you need to transfer the patient, it is done by which positioning? Log roll positioning. It is done by log roll positioning. ठीक है? No issues with the stabilization of cervical spine should be done. Then if I talk about important cause or the most common cause of death, okay, if I talk about most common cause of death in trauma patients, the answer would be most common cause of death in trauma patients. The answer is most common cause of death in trauma patient is head injury, right? And head injury, if a patient comes to you with head injury, what should be assessed? You will assess the ISS, that is injury severity score, revised trauma score. Okay, all of that would be assessed. But the commonly assessed one, ये बस book के है, हम नहीं करते थे. ठीक है, आधों को तो याद भी नहीं होगा, जाओ हॉस्पिटल में, आधों को पता नहीं क्या है. ठीक है, so it is the GCS, Glasgow Coma Scale. ठीक है, it is the Glasgow Coma Scale. So Glasgow Coma Scale is known as GCS. Please tell me what is the maximum GCS score? Maximum GCS score is minimum GCS score is तो minimum सबका 111 होगा. Which three responses are assessed? E for eye response, V for verbal response, and M for motor response. So the mnemonic is EVM. Mamta Banerjee wala. Then it is 4, 5, 6. Okay. The mnemonic is EVM. EVM. If they ask you most sensitive response or most sensitive indicator out of all three, motor response. Most sensitive is the motor response. Most sensitive is the motor response. No issue. ये one liners है. One liners हम भूल जाते इसीलिए करवा रहा हूँ. ठीक है. Then if I talk about GCS, हमारी आएगी अब अम्मा. ठीक है. So now अम्मा comes to you. She met with a road traffic accident. ठीक है. बेटा चला रहा था, नया नया गाड़ी सीखा था, and now उसने ठोक दी गाड़ी. अम्मा उड़ के गिर गई कहीं और. अब आई है हॉस्पिटल में. ठीक है. Now अम्मा is brought to the hospital. You will check. She is brought with head injury. You will check for eye, verbal, and motor response. If Amma opens the eye spontaneously, so that is E4. Amma opens eye spontaneously, it is E. Amma opens eye spontaneously, it is E. If Amma opens the eyes on calling Amma, aap kholo, then it is E. On sound, it is E. On sound, it is E. If Amma opens the eyes on pain or pressure, थप्पड़ मारो अम्मा को और फिर अम्मा आँख खोले, then it is E. Then it is E. थप्पड़ पे आँख खोले तो E. If अम्मा आँख ही नहीं खोल रही, E. इतने जल्दी मत मार. It is E1. Next, if I talk about verbal responses now, ठीक है? Maximum verbal responses 5. So if अम्मा is oriented to time, place and person, she knows where she is. पूछोगे अम्मा कहाँ हो? बोलेगी अस्पताल में. मैं कौन हूँ? बोलोगे डॉक्टर. ठीक है? Then it is V5. Then it is V. So oriented is V. Then अम्मा की अगर बात करूं, अम्मा is confused now. ठीक है? अम्मा को पूछोगे कहाँ हो अम्मा? बोलती पता नहीं. ठीक है? बोलती स्मशान घाट में. और तुम कौन हो? बोलती पुजारी. Then अम्मा is confused. So it is V4. Then it is V4. If अम्मा अगर तुमने बोला अम्मा आँख खोलो या अम्मा कुछ बोलो और अम्मा ने आँख खोलती बोल दिया, ठीक है? Then it is V3. तो अगर गाली बक दी, then it is V3. So inappropriate words are then अगर अम्मा बस आ ऊ sounds निकाल रही है, incomprehensible sounds are V2. Incomprehensible sounds are V2. And अम्मा आवाज ही नहीं निकाल रही. देख लेना पहले अम्मा गूंगी तो नहीं है कहीं. Next, if I talk about motor response, guys. Next, if I talk about motor response, maximum motor response is 6. If Amma obeys the command, if you say Amma haath uthao, Amma haath utha di, then it is M6. Then it is M6. If Amma ko पूछोगे Amma pain कहाँ हो रहा है, and she localizes the pain, then it is M5. Then it is M5. Then if Amma like usually withdraws on pain, ठीक है? Normal flexion बोल सकते हो या withdraws on pain. तुमने चूटी काटी अम्मा को, you pinched her and she suddenly withdrawed. थप्पड़ भी मार सकती है. So if suddenly withdraws, then it is M4. Withdrawal on plane is M4. Abnormal flexion or decorticate position is M3. Abnormal flexion or decorticate position is M. Abnormal extension or decerebrate position is M. Abnormal extension or decerebrate position is M. और अम्मा कुछ कर ही नहीं रही, M1. It is M1. So Glasgow coma scale maximum is 15, minimum is 3. So अगर अम्मा का score is between 13 to 15, अम्मा has a mild head injury. Okay, mild head injury is between. If अम्मा has a score of 9 to 12, then it is moderate head injury. 9 to 12 is moderate. Moderate head injury is mild head injury is and severe head injury is 3 to 8 is severe head injury. And अगर अम्मा का स्कोर 3 आता है, then the अम्मा is brain dead. सुधार नहीं गई अब तक. अम्मा is brain dead. ठीक है? अम्मा is brain dead. बचा नहीं सकते उसको. ठीक है? And if they say, like, if they write something like this, that means the verbal response is not testable. It is not testable because the patient is intubated. Maybe the patient is intubated or the verbal response was not testable. So either they can write as NT or they can only write T. Okay? That means the patient is intubated and therefore the verbal response cannot be assessed. ठीक है? कोई इश्यू नहीं है. And अगर वो GCS P लिखता है, P goes for which response? GCS P goes for which response? P goes for pupillary response. P goes for pupillary response. P goes for pupillary response. Okay? So P2 is when both the pupils are reacting. Bilateral reacting pupils. P1 when one pupil is non-reactive, and P0 when both the pupils are non-reactive. इसमें समझ जाओ टपक गई. ठीक है? No issues with this. GCS समझ गए? घर पे जाके अम्मा को याद करना भी. ठीक है? Moving further, talking about intracranial hemorrhages. ये सबको आता है, जल्दी से रिवाइज करेंगे. So if a patient presents to you with head injury, there is a high risk of intracranial hemorrhages in the patient. And the investigation of choice to rule out it is investigation of choice is NCCT head. ठीक है? So if on an NCCT head you can get this type of biconvex opacity. So you get a biconvex opacity or a lens-shaped opacity. It is a biconvex or lens-shaped opacity. Biconvex or lens-shaped opacity. EDH, that is extradural hemorrhage. EDH is extradural hemorrhage. ठीक है? Extradural hemorrhage means the hemorrhage is between the dura mater and the skull. Between the dura mater and the skull. So which type of opacity is seen in EDH? Biconvex or lens-shaped opacity. Important. Now, which patient gets unconscious, then conscious, and then again unconscious? This is known as lucid interval is seen in? Lucid interval is seen in? What is seen in EDH? Most common vessel to be affected in EDH is middle meningeal artery. Most common vessel to be affected is middle meningeal artery. Important. Most common cause is trauma, road traffic accidents usually. Most common cause is trauma in the patient. Okay, no issues with this. Then treatment of choice would be burr hole decompressive surgery. Burr hole decompressive surgery. And the landmark for burr hole surgery is landmark for middle meningeal artery is Turion. No issue. सबने रटा हुआ है. शाबाश. एक क्वेश्चन फिक्स है इसका. Next, if I talk about this one, दो भी हो सकता है. So if I get this type of opacity, on it is which type of hemorrhage? SDH, subdural hemorrhage. That means hemorrhage between the dura mater and the arachnoid matter. ठीक है? Which type of opacity is seen? Which type of opacity is seen? Concavo, convex. Which type of opacity is seen? अरे बाय लिख दिया गलती से. Which type of opacity is seen? Concavo, convex opacity. Also known as which type of opacity? Eccentric opacity. Also known as which type of opacity? Eccentric opacity. Now, in the case, if you are not able, on the NCCT picture, if you are not able to diagnose whether it is a concave or convex or a eccentric opacity, then very good. Then you need to check for a midline shift. The ventricles would be shifted towards the other side. So there would be a midline shift. Okay? So both of these things should be there. Then SDH or subdural hemorrhage is most commonly seen in which age group? It is usually seen in extremes of ages. That means either in children or in elderly or children or इनमें दिखता है. The most common vessel to rupture are the cortical emissary bridging veins. The most common vessel to rupture are the cortical emissary bridging veins. So if they ask you only venous intracranial hemorrhage, answer is SDH. Only venous intracranial hemorrhage, answer is SDH. ये question आ चुका है. ठीक है? Now, important. Most common cause of SDH would be trauma again. Most common cause of SDH is trauma. But this trauma would be a trivial trauma. Means a minor trauma. The patient just ये classical case है. The patient just बुढ़ा था, hypertensive, diabetic जो भी. The patient slipped in the bathroom, and after some days the patient comes to you. So it is not the patient will not immediately come to you after trauma. So the most common cause would be a trivial or a very minor trauma to the patient. ठीक है? And when the patient will come to you, when there would be headache or any focal neurological deficit or any of the symptoms would be there. Okay, at that time the patient will come to you. If the patient comes within 3 days, it is called as which type of SDH? Acute SDH. Within 3 days a day? Within 3 days a day? 3 to 21 days? Subacute. 3 to 21 days. This was the question. 3 to 21 days? 3 to 21 days? 3 to 21 days? After 21 days? Chronic. After 21 days? Chronic SDH. No issues with this. SDH means if the patient is not having any symptoms, only observation and monitoring is done. If the patient is asymptomatic, only observation and but if the patient is having symptoms, that means either headache or any raised ICP features are there. Bradycardia, hypotension and Cheney-Stokes breathing. Cushing's triad yaad kar lo. So then in symptomatic patients the treatment would be either you can first try with this one. Burr surgery isme bhi kar sakte if the size is more than 1 centimeter ka ho. ठीक है? So usually first of all to reduce the cerebral edema you will give IV mannitol to reduce the cerebral edema, or you can even perform a decompressive burr hole surgery. No issues with this. Moving further. Next, this type of NCCT head picture if you get. So this in this NCCT head everything seems to be normal except one structure, and that is your ventricles. Okay? If you see the horns of the ventricles and the Sylvian fissure, what is seen? Opacity is seen. So if the opacity is within the ventricles and the Sylvian fissure, then this is called as which type of hemorrhage? Subarachnoid hemorrhage. This is called as subarachnoid hemorrhage. When the bleeding would be within the subarachnoid space, mixing with the CSF. Okay? So opacity is seen where in SAH? Ventricles and Sylvian fissure. Ventricles and Sylvian fissure are no issues with this. Here the most common complaint of the patient would be there would be an excessive headache in the patient, and that would be described as thunderclap headache, also known as worst headache of my life. So this classical feature agar question mein hai, you will directly suspect SAH. Thunderclap headache, worst headache of my life, SAH. Okay, most common cause of SAH, anybody? Most common cause is rupture of berry aneurysms, also occurs due to trauma. So the most common cause would be, and the most common vessel to be injured are the, and these very small aneurysms are most commonly seen in which artery of the circle of Willis? Anterior communicating artery. Anterior. The most common site for berry aneurysms is the anterior communicating artery, and the most common cause of SAH is trauma due to rupture of berry aneurysm. Okay? If I perform a lumbar puncture, though it is contraindicated, after 3 days I can perform a lumbar puncture. On that I can get which type of CSF? Very good. A blood mixed CSF. This is called as yellow colored, known as a xanthochromic CSF. Which type of CSF is seen? Xanthochromic CSF. No issues with this. What is the drug of choice? Jaldi. The drug of choice is IV. Nimodipine. Drug of choice is IV to decrease the intracranial tension. Next, here, if on NCCT, I can get an opacity within the cerebrum. That is within the parenchyma. Okay? Along with what is seen? There is a midline shift. Then it is suggestive of a intracerebral hemorrhage. Intracerebral hemorrhage is common in which age group? It is more common in elderly patient. ICH is more common. Intracerebral hemorrhage is more common in elderly patient. And the most common cause for it is uncontrolled hypertension or hypertensive crisis due to non-compliant. मतलब patient drug नहीं ले रहा था. and that causes rupture of these vessels in the brain, leading to intracerebral hemorrhage. Most common causes hypertension. Most common age group is elderly. NCCT shows opacity within the cerebrum and there would be a midline shift. Okay? Most common site is Gautam, a part of basal ganglia. And the most common vessel would be, very good, the most common vessel is the Charcot's artery. Most common vessel is the Charcot's artery, also known as the lenticulostriate artery. So most common vessel injured in intracerebral hemorrhage is Charcot's artery. Charcot's artery is also known as lenticulostriate artery. No issues with this. And drug of choice, last. Drug of choice for ICH is IV nicardipine. The drug of choice for ICH is IV nicardipine. तो इधर उधर घूम लेना थोड़ा, ठीक है, ऐसे लिख रहा हूं मैं. ये करके ब्रेक ले लेते. ट्रॉमा, ठीक है, ट्रॉमा पूरा नहीं करेंगे. चलो ये स्लाइड कर लो, फिर ब्रेक ले लो. कितना टाइम हुआ है? 1 बजे स्टार्ट किया है मैंने. चलो ठीक है, ले लो यार. 3:10 हो रहा है. 3:20 को मैं स्टार्ट कर रहा हूँ सेशन वापस.
सेशन ये 4 साढ़े 4 तक चलेगा या लंबा चलेगा?
4:30 की क्लास है. कितना बचा है? कितना कवर कर लिया हमने? 10 स्लाइड. नहीं, इंट्रापैरेंकाइमल, इंट्रासेरेब्रल थी. इंट्राक्रेनियल मतलब क्रेनियम के अंदर कोई भी, वो चारों टाइप के हो. इंट्रासेरेब्रल या इंट्रापैरेंकाइमल, मतलब इसी का दूसरा नाम है. इधर लिख तो बड़ी. इंट्रासेरेब्रल इज आल्सो कॉल्ड एज इंट्रापैरेंकाइमल हेमोरेज. इट इज द सेम. पैरेंकाइमा में कोई भी हेमोरेज. क्या Gautam है. Charcot's artery, CHARCOT, Charcot's artery. Lenticulostriate भी बोलते हैं.
इसमें एनजीटी में से डालें.
किसमें? अनकॉन्शियस ना, तो डायरेक्टली तुम सुपाइन पेशेंट होगा, जली लगा के डायरेक्टली तुम मैसेज डाले. ठीक है, थोड़ा बहुत फ्लेक्स अगर करना है कि तुम्हें अगर ये नहीं मिल रहा है, नीज़ोफैरिंक्स क्लोज दिख रहा है, तो थोड़ा सा उठाने के लिए तुम ही उठा सकते हो, किसी और को उठाने के लिए बोल दो अटेंडेंस को.
चेक कैसे करते कि सही गई है कि नहीं?
हाँ, वो बताना रहेगा. ठीक है, तो यूजुअली यू एस्पिरेट द गैस्ट्रिक कंटेंट एक तो सिरिंज के साथ, या फिर सिरिंज, बड़ी सिरिंज होती है 50 सीसी की, तो तुम एपिगैस्ट्रियम पे स्थित रखोगे और सिरिंज से पुश करोगे एयर. अगर यहाँ पे हिसिंग साउंड आ रहा है, दैट मींस द आरटी इज करेक्टली प्लेस्ड. तो दोनों में से एक चीज कर सकते हैं, द एस्पिरेशन ऑफ गैस्ट्रिक कंटेंट या फिर hissing sound with stethoscope when you push the air into the artery. देखते हैं टाइप. अभी 15 तक तो मेरा इसका टारगेट है. 16 को मैं एनाटॉमी का सेशन ले रहा हूँ. उसके बाद बायोकेम का देखना पड़ेगा. कंटेंट मेरे पास वो बना पड़ा, उसी से देख सकता हूँ. अगर मैं देखूँ इसका क्यूआरएस का क्या सीन है, अगर प्रियांक सर नहीं आ रहे तो ले लेता हूँ. अगर प्रियांक सर आ रहे तो बेटर, कोई ना कोई तुम्हारा और सब्जेक्ट हो जाएगा. बेटर है.
प्रियांक सर खुद लेंगे ना?
प्रियांक सर खुद लेंगे, इसीलिए मैं बोल रहा हूँ ना.